Good morning. This morning I was able to hunt down Dr. Jeff Gaynock, our ketamine infusion expert, and ask him a few questions that I wanted to, I know you guys have been asking about. So here we go. Here's some questions and answer session with Dr. Jeff Gaynock.
So people who benefit from ketamine infusions, primarily major depressive disorder, PTSD, anxiety, but we can also give them for pain infusions as well if you have chronic pain issues. Those are the primary people that we're looking for ketamine infusions. So we work hand in hand with your primary care provider. If they want to contact us, we're more than willing to talk about it. However, it's not a barrier to getting an infusion. Depending on how booked we are for when you call, you could be seen as soon as the next day or the next week. Typically, patients don't have to wait more than a few days to get in for an infusion. So the most common things that patients tell me, and to put this in perspective as far as side effects go, you take a much greater chance of having any negative side effects when you drive your car here and getting in a car accident. The risk is very, very low. However, some of the things that I occasionally see is we have some nausea, very rare. I've done almost 200 infusions and I've only had about 5 patients complain of nausea. What we do to prevent that is we give medications through the infusion to help prevent the nausea before it even starts. Some people can develop a little bit of anxiety with when the ketamine infusion begins. You can have kind of a disassociated feeling. Usually it's just a matter of me regrounding you and letting you know you're in a safe spot and just trusting and letting know the medicine do what it's supposed to do. So ketamine infusion, the effects last through that day and into the next day. Patients tell me that they feel good immediately after the infusion, and then the next day they feel good as well. It starts to wax and wane after that. That's why we do the 6 infusions. Try and get like 2 to 3 a week. Try and get 6 in 2 to 3 weeks. Once we get those 6 infusions in, the effects last anywhere from 2 weeks all the way up to 2 months typically. And then when you need to come back in, we'll just do 1 infusion. It's called a booster infusion, and that's completely based upon your symptoms. So the way the infusion process works is step 1 is you call for a free consult, and that consultation is with me. Once you decide ketamine is for you, we book an appointment, you come in, I have you sign some paperwork, get a set of vital signs on you, we start an IV, the infusion runs over 40 minutes intravenously. Upon the completion of the infusion, you hang out for about anywhere between 20 to 30 minutes until you feel like you're grounded enough, and then someone will drive you home. During your infusion, we'll have low lights, quiet music, a very, very calm, kind of like a spa-like environment. You're in a very comfortable chair, just kind of relaxing. You have a monitor monitoring your heart rate and blood pressure. That's unobtrusive. It doesn't make any noise. It's just for me to let you know you're doing okay. So to schedule an appointment, you would call 719-464-6752, or you can follow us on Instagram or Facebook, YouTube. I have a Twitter account, as well as a hashtag KCS Infused. You can follow us there as well. Also on Google if you want to leave us a review.